This is Gary Atensi with CNTV, and today we're in Centennial, Colorado. I'm here with the laser treatment specialists. Since 2010, they have been Colorado's original laser nail fungus specialty clinic, serving folks not only here in Centennial, but in Denver and the surrounding areas. I'm here with Daniel, who is the owner, founder. Thanks so much for joining us here today. Let's start off a little bit, first of all, about yourself. You are a Colorado native. You were formerly educated here with a master's degree. You went on to basically be a graduate of the Rocky Mountain Laser College. You began this in 2010. You felt there was a need here in Centennial, but you yourself have over 2 decades really of experience when it comes to learning and teaching in this type of industry. Tell me how it is you got started doing this.
Well, Gary, you know, in 1997, about a year out of college, I started in the pharmaceutical field. And so I have had a long duration in the pharmaceutical sales field, about 8 years. And during that time, I had always been on the lookout for a way to deliver a treatment, a non-invasive, non-medication treatment as an alternative to systemic and oral medications. And use of laser treatment for nail fungus was something that I learned about in mid-2010 and put together a clinical model. So my entire business is founded on a clinical model that optimizes outcomes over time with absolutely no safety concerns.
Wow, that is a great story. I mean, quite honestly, the consumers, patients out there, we all want to look our best, feel our best from head to toe. Let's start at the bottom and work our way up. First of all, let's talk about a common disease there of toes, which is fungus. Tell us a little bit, is that more common than what people even realize many times?
The statistics on a nail fungus, otherwise known as onychomycosis, the medical term, are 7 to 12% of the population. So there's a wide range. Then there are other statistics that indicate it's higher. It's perhaps 12 to 15 or even 20% of the population. So it does affect 40% of men over 50. So it is a little bit more common among men, but I also see quite a few women. So the split is about 50-50 in all age ranges, all the way from late teenagers all the way up to the early 90s. So there's a very wide age spectrum, so it can affect anybody throughout their course.
Not only that, but some are mild and some are severe, I would imagine. What do they know what causes this abnormality? 80%
of nail fungus cases are caused by one specific genus and species of fungus. It's called Trichophyton rubrum, or abbreviated as T. rubrum. And then there are other esoteric organisms that can cause the other 20%. Some are fungus, some are actually non-dermatophyte molds, and some are actually yeast species. But the T. rubrum is the most common cause.
What are some of the early symptoms that people should be on the lookout for?
Discoloration under the nail plate, a layer of spongy mass building up under the nail plate, and also sometimes there can be some discomfort, but it's typically non-symptomatic. It's more of a cosmetic issue, and but primarily the discoloration. That's the number one indication that there's a mycotic infection, is a yellow or a brown or sometimes a white appearance of the nail plate. And that's usually follows some type of trauma, which is the leading cause of nail fungus, either clipping a nail too short, which is actually the most common type of trauma, or any type of acute injury like dropping a brick on your foot or stubbing your toe can lead to a nail fungus.
Is it a good idea for people to take care of these symptoms early on rather than leaving them untreated? I would imagine if they're untreated, they can become inflamed and even painful. Is that the case?
Over time, the nail can thicken as the fungus build up the byproduct of enzymal secretion, and that is referred to as hyperkeratosis, and that can actually put a lot of pressure on footwear, and that can lead to inflammation of the nail bed. And so it can be very uncomfortable. And that needs to be filed down. That's part of the process of our treatment.
We're talking about toes, but this can also take place on your hands as well. Is that correct?
Fingernail infection can also occur, but it's less common because the fingernails grow at twice the rate of toenails. And it's also usually caused by candidal or yeast species, not so much fungal species. So I do treat that, and I've treated that very successfully, and it usually takes about half the time to clear it, but it is less common because of the growth rate of fingernails. And also the circulation and the fact that fingernails are exposed to a dry, cool environment, whereas the heat are exposed to a throughout the day at least, a warmer and more humid environment, which is conducive to fungal growth and proliferation. Excuse me.
We live here in Colorado. I mean, as soon as the weather warms up, we throw on the flip-flops, the shorts, we're out and about. I would imagine something like this would even affect somebody's social confidence when they're out and about.
Yes, in fact, a lot of folks, males and females, are self-conscious of their nails and will either wear Band-Aids in some cases, in extreme cases, or just keep their toes covered up, anything other than open-toed shoes. And so they're seeking this treatment as a cosmetic solution, a non-drug cosmetic solution, correct?
Interesting. Before we actually discuss some of the laser technology that you're using here, tell me first of all, what do people do to get rid of this before laser came along?
The traditional methodology for treatment is oral medication, 3 months of oral medication. There are also topicals, but they're very marginally effective. The statistics are very poor on those. But the oral medication that's traditionally prescribed is called terbinafine, otherwise folks may otherwise know it as Lamisil. It's now a generic product, and it was actually introduced when I was in the pharmaceutical field as a branded product. So I've actually been aware of Lamisil, 15 years before I started this business. The risk factors include hepatic or liver toxicity, and there's also a fairly substantial relapse rate. So there are safety concerns associated with it, but even more importantly, the clinical outcomes are somewhat marginal in terms of, if you think of taking an oral medication to reach the capillaries of the nail bed so that the active ingredient accumulates in the nail matrix, that's the farthest end of your circulation, and that's the reason it's dosed at 250 milligrams once a day for 3 months.
You've had great success with laser treatment. We're talking over 7,000 cases. The proof is in the photos. I mean, some of these are quite amazing. You're really dealing with something that not only seems to work, but actually works, and you've actually experienced that.
Correct. So when a client comes in for the first time, I always start off with a complimentary consult evaluation, and the best one word to summarize the treatment is optimal. There's no panacea. It works very, very well for most people. There are variables that make the treatments a little bit more complicated. For instance, poor compliance and perhaps severe trauma, where the nail's more like a clamshell than a nail and it doesn't grow out at the normal rate. And that still can be treated. It just takes substantially longer. So it is really a gold standard optimal treatment that can be done completely safely and implements the synergy of the laser, which is heat absorbing the water, with actually do also use a topical medication that's a compounded agent that's nail penetrating, and that synergizes with the laser very nicely.
Like you said, this was founded on a clinical model that you put together. It's really a refined technique that basically making sure that it's a daily regimen to make sure that the duration was long enough, as well as the intensity of what you're doing. Is that correct?
Correct. So one of the most important aspects of the treatment is to have a treatment duration that's adequate for the fungal nail to grow out completely. So that's where a lot of treatments fail, is they treat some percentage less than 100 of when that nail, and it must be done on a nail by nail basis, and that's one of the things that I focus on is treating. If somebody comes in with 1 nail or 10 nails, each nail is treated individually. So over time, they may require follow-ups and so forth on those nails that perhaps are growing slower or more severe or have more surface area infected.
So basically, it would be very probably important to educate viewers out there that not all lasers are alike. I mean, quite honestly, you work with something called the Cool Touch. Tell me why that was an important piece of equipment for you.
So it is in fact, the laser is an important element. I consider it one tool in the process that I deliver. Exactly. The wavelength itself is only absorbing water. It's very specific to water, and water is the key target. There are no other targets that are proven to be relevant in the terms of eradicating dermatophytes in the nail plate. Because if you think about fungal organisms, where does fungus thrive and proliferate? In a damp environment. Any species that's even related to fungus. So it's really water is the main target. And the laser spot size, it varies from 3 to 10 millimeters. So no matter what the nail size, I can get around the perimeter of the nail and have the precise laser size to treat any size nail adequately.
I mean, so if it's targeting water, this can be used on any skin types, dark, light, or you name it.
Correct. And so I also do offer non-ablative skin resurfacing, non-ablative fine line wrinkle reduction, as well as acne and acne scarring. Skin resurfacing is more of a deeper penetration. I do offer that as well, but the Cool Touch laser actually is more of a non-ablative, meaning non-burning. And it does absorb water, but instead of treating the nail, I actually use it to build collagen in the dermal layer of the skin, which reduces the effect of fine lines and wrinkles and acne scars, as well as shrinks the oil or sebaceous gland in active acne. So there are other uses for the laser.
As laser gets more popular, we hear more about it. We therefore see a lot of specialists out there that maybe are claiming one-day cures for something like this, where it takes very in-depth, intense. Are the lasers themselves maybe many times different than what people use on, let's say, tattoo removal or even vein removal?
Yeah, substantially different. So again, the laser that I chose to use when I founded the business, I wouldn't trade for anything on the market, simply because the criteria that are required for an optimal laser treatment, I believe this fulfills all of those. So it's not just the laser, though. It's really the intervals, the settings, the technique. It's a number of other parameters so it's the right tool, but it also has to be used the right way over the right course of time with other adjunctive elements as well.
When consumers are out there and they're maybe shopping around for someone to take care of this for them, what should they look for? I mean, when we're talking about specialists who are saying they can, maybe short-term make it happen for them, maybe not even have photos to back up what they're claiming, what would you recommend people take a look for?
So an adequate description of the process is important, the actual process and what differentiates that process. But I think the most important is photos and testimonials. I've had full-name testimonials on my website. I've had a lot of very, very pleased clients. And it's something, again, that I've specialized in now for 6 years. And at the time that I started, I was the only certified laser specialist, or CLS, in the state of Colorado to specialize in nails. So I've amassed quite a number of treatments and have developed a higher and higher level of confidence as time progresses in terms of outcomes and satisfied patients and sustainable clear nail. And that's the key. It's sustained, meaning it doesn't come back because it's treated appropriately.
I see a lot of testimonials online, people that basically just after a few months down the line are amazed that it looks so different. They feel so much better about it. Let me ask you this. As far as the experience goes, the process, share with our viewers, it's pretty much is virtually painless. I mean, it's something they come in, it only takes, under half an hour, and you don't have to give up any of your daytime activities, really.
Right. The actual laser treatment itself is anywhere from 5 to 15, maybe 20 minutes. And I spend time in the first visit very thoroughly explaining the process, answering any questions clients may have, taking photos. And that's another thing. I document all of my cases in terms of chart work as well as photos. And the photos are the most important because without the photos, it's difficult to really gauge rate of progress over time. But the actual treatment, I wouldn't say it's painful. It's not painless. There's a bit of a sting at the end of each pass, but it dissipates immediately. And that's something that's been very consistent across the thousands of treatments that I've done, is there's no lingering pain. There's no ablation or burning to the tissue. It's completely safe, and it's nothing more than a short sting that goes away as soon as the laser's taken off. And you go to the next nail or just wait a couple seconds to retreat it. And I do anywhere from 8 to 15 or more passes on each nail.
What is great is that there's no side effects, because we're not talking about oral, taking anything in or something you could be allergic to. It's safe, it's proven, and actually it's done over a period of time, so can it be pretty much affordable?
Right. So as far as it being to the site of infection, I think is what you're referring to. So drug delivery, traditionally, when I was in the pharmaceutical field, one of the key elements of treating some of these difficult infections, is delivering drug to the site of infection. They came up with all kinds of novel ways to deliver drug to the site of infection. Well, with this treatment, you're delivering laser energy to the site of infection, and laser energy that's not harmful or ionizing or in any way damaging to healthy tissue. That's the beauty of it. It's completely safe. It's just heat. It's infrared. If you look at the spectrum of energy, it's just heat. That's very specific wavelength of energy absorbing only water.
Excellent. Viewers, take a look at the bottom of the screen right there. What you're going to see, first of all, is his website. On the website, you're going to see it's chock full of testimonials, many, many photographs. He basically documents each one of the cases, helping you understand more about the process you're going through. And it can also share that with others that are coming in as well. Take a look at basically, this is an organization that began in 2010, but he brings basically 2 decades of experience to the field, basically looking to provide an effective treatment that really got to the heart of the matter and took care of things that probably came back over and over again, I would imagine, for a lot of people.
Correct.
One of the things you talked about, we talk about from head to toe, the face, wrinkles, blemishes, acne, scarring. These are all things that you can address as well.
Correct. So I specialize in nails, of course, but I also, my secondary specialty is skin resurfacing and fine line wrinkle reduction. I have other technologies that I bring in-house. So there is a secondary specialty that I use to diversify a little bit, some of it with the laser that I have, and I do bring other technologies in. But my core competency is laser nail treatment.
Absolutely.
No fungus.
That is really what you focus on, what you basically, when you put together the clinical study and decided what you're going to help people with. Has it been rewarding for you in just a short period of time? And in 2010 is not a long time ago, yet you have quite a few testimonials. I imagine you have heard people, stories out there that couldn't take care of it. Has this been rewarding for you?
Outside of having 2 boys and a wonderful wife, this has been the most blessed thing that has ever happened to me. I absolutely love doing this. I think by putting the client first and clinical outcomes first as the absolute priority, I've been able to sustain a very healthy and prosperous business that is truly rewarding. I'm absolutely blessed to be doing this, and I meet wonderful people from every walk of life you can imagine, every profession, every age. It is absolutely wonderful. It's been a great.
Every walk of life and making their walk of life a lot better. Last time viewers, take a look at the bottom of the screen. You're going to see his contact information right there. Basically, make sure and give him a call and set up a free consultation. During the consultation, he'll sit down, show you many photographs, explain to you, be it a mild or severe case that you're going through, and it's something that basically you shouldn't be afraid of to come on in and experience. Remember, this is an organization that began in 2010, and so if you're basically saying there's a fungus among us, there is no need to say that. Basically, come on in and they'll get you taken care of. This is Gary Atencia with CNTV. And if you don't know, now you know.